Good day everyone. Good day Ma'am Lorna. I'm Samantha Paclaon, a caregiving student from Philippine Women's University, Batch 151. And for today's video, I'm here to demonstrate bathing the adult. The reason for bathing the adult is, first, bathing stimulates the skin and improves circulation. The second one is, bathing requires movement of the muscles. And for the guidelines for bathing the adult, first one is observe the safety rules. Second one is keep the client's body in a proper alignment. The third one is continually observe the client for distress. If he or she appears tired or uncomfortable, stop the bath. And for the materials needed, we will be using basin with water. For the oral hygiene articles, toothpaste, toothbrush, gargle, and a glass of water, kidney basin, lip gloss, washcloth, clean gloves. And for the personal hygiene, we will be using powder, lotion, oil, deodorant, cotton buds, cotton balls, shampoo, bath soap, comb, forceps, betadine solution, shaving kit for male clients, bath towel, clean gown, clothes as needed, bedpan or urinal, kelly pad, empty container for the discarded materials, a large basin, pail and dipper, and a laundry hamper. In doing the bathing the adult, first, assemble all the materials needed. Second, do the proper hand washing and observe appropriate infection control measures. And the third one is establish rapport. Explain to your client what you are going to do, why it is necessary, and how he or she can cooperate. Sir, magandang araw po. Kamusta po kayo?
Okay lang.
Kamusta naman po ang inyong pakiramdam?
Okay lang.
Nakakain po ba?
Ako.
Ako nga po pala si Samantha Paclaon. Isang caregiving student po ako mula sa PWU. At narito po ako upang kayo ay paliguan, upang maging malinis at magaan ang inyong pakiramdam. At kung sakali man po na kayo po ay hindi maging komportable, ay sabihin nyo lang po agad sa akin. Marami pong salamat. Provide privacy by drawing the curtains around the bed or closing the door. The rationale of this, hygiene is a personal matter. Prepare the bed and position the client appropriately. Sir, mag-uumpisa na po tayo. Lower the side rail on the side close to you, while keeping the other side rail up. And for the oral care, it includes the cleansing of the mouth, gums, teeth, or dentures. Position the client into a sitting position or high powder's position. Lower the handrails. Sir, assist ko po kayo, upo po tayo para makapagsipilyo. 1, 2, 3. 1, 2, 3. And then, spread the towel across the client's chest to protect him. Sir, lagay ko lang po ito. Offer the client water to rinse his mouth and hold the basin under the client's chin for him to spit the water. Sir, umupo tayo. Isa pa po. Put a pea size of toothpaste in a wet toothbrush and do the oral care. And then, use a gentle motion starting above the gum line, going down to the teeth. Sir, nangalang po tayo. And then, offer the client's water again. Offer a client's gargle. Sir, gargle po tayo. Apply a lip gloss to keep the lips moist and prevent it from chapping. Sir, lagay ko lang po yung lip gloss. And then, make the client comfortable and put away all the materials used and clean. One, two, three. One, two, three. Fill the basin with 2/3 full of warm water. And then, remove the client's nightgown and jewelry. Sir, tanggalin ko lang po ito. Place the soiled clothes directly on the hamper. Remove the jewelry and keep it in the safe place. Assist the client to move to the side of the bed closest to you by using a good body mechanics. Sir, usog ko lang po kayo. One, two, three. One, two, three. Using a washcloth, do the soak, squeeze, and knead technique. The rationale of this, a bath mitt retains the water and heat better than the washcloth, loosely held, and prevent the end of the washcloth from dragging across the skin. Wash the client's eyes with water only Use the separate corner of the washcloth for each eye. Wipe from inner canthus to the outer canthus. Using separate corners, prevent transmitting of microorganisms from one eye to another. And then, clean the client's nose using a cotton buds, using up and back technique. Clean the client's nose. Discard. And another cotton buds to clean his ears. Discard. And then, wash the face using a C-track method. Soak, squeeze, and knead. C-track method after the back of the ears and neck, and place the soiled washcloth directly to the hamper, and then empty the water and refill. And for the shampooing, position the client diagonally. Assist him to the side of the bed. Sir, usog ko lang po kayo. 1, 2, 3. Remove the accessories and comb it. And then, place the Kelly pad on the bed under the head. Sir, lagay ko lang po ito. Place the bath towel. Sir, at lagay ko lang po ito. And then, remove the pillow. Excuse me lang, sir. And place the pillow under his shoulder. Tuck the bath towel around the client's shoulder. And then, place a cotton balls in the client's ear. Sir, lagay ko lang po ito, cotton balls. Hindi po mabasahin. Is to prevent the water getting inside to the client's ear. Wet the client's hair. And then, apply a small amount of shampoo and lather it. Massage the scalp with the fingertips. Massage starting from the front towards to the back of the neck. And then, rinse and squeeze. And dry the hair thoroughly. Remove the cotton balls. Discard. And remove the chemical. So, excuse me po. Place the client back to a comfortable position. Sir, excuse me lang po. One, two, three. One, two, three. And then, comb the client's hair. Empty and refill the water again. And for the chest and abdomen, place the towel lengthwise over the client's chest. Using a washcloth, soak, squeeze, and knead. Wash the client's chest and abdomen with the mitted hand using a long firm strokes. Paying attention to the skin under the breast, umbilicus, and other skin fold. Soak, squeeze, and knead again. Using a hand soap, apply a small amount and then soak again. Soak and squeeze and knead again. Again, paying attention to the skin under the breast and umbilicus and other skin fold. Using another clean separate washcloth. Pat dry again. Again, paying attention to the skin under the breast, umbilicus, and other skin fold. And then, empty the dirty water and refill it again. And for the arms and hands, Put a towel lengthwise under the client's arm, farthest from you. Place a towel lengthwise, sir. Lagay ko lang po. Using a washcloth, soak, squeeze, and knead. Use a long firm stroke and circular motion starting from the wrist to the shoulder, including the axilla up to the shoulder. And then soak and squeeze again. And knead. Apply a soap, then repeat it again. From the wrist to the shoulder, axilla, up to the shoulder, and then soak, squeeze, and knead again. Then rinse. And dry. Pat dry the arms. Axilla and shoulders. Immerse the hand in the basin by paying attention into the interdigital spaces. Rinse and using a soap, lather it. And then rinse. And then using a towel, pat dry. Then repeat the arm nearest you. Empty and refill the water again. And for the back care and massage, assist the client to a side-lying or prone position facing away from you. Kayo, dapa po tayo. 1, 2, 3. 1, 2, 3. Ayos ko lang po yung paa niya, sir. 1, 2, 3. Put the towel lengthwise on the bottom sheet, nears the client's back and buttocks. And then, using a washcloth, soak, squeeze, and knead the towel. Using a long firm stroke, wet the client's back. Soak, squeeze, and knead again. Rub a soap, and then using a long firm stroke, soak the client's back. Soak, squeeze, and knead again. Using a long firm stroke, rinse the client's back. And then, pat dry the client's back. Do the back massage using the following step. Sir, massage ko po yung likod nyo. Ano pong gusto nyo? Powder, lotion, or oil?
Okay.
Sige po, sir. Salamat. Using a lotion, effleurage, consisting of long, slow, gliding stroke butterfly. Sir, massage ko na po kayo. And then, assist the client's back to a comfortable position. Sir, tulungan ko na po kayo. Higa na po ulit tayo. 1, 2, 3. 1, 2, 3. Empty and refill the water again. For the legs and feet, put a towel lengthwise to the client's leg farthest from you. Sir, lagyan ko lang po ng towel. Put the towel lengthwise. Position the client into a dorsal recumbent. And then, wet soap, rinse and dry using a long firm stroke. Using a washcloth, soak, squeeze, and knead. Wet the client's leg from the knee longitudinal towards to the inguinal area. From the knee, longitudinal towards to the foot. And then, soak, squeeze, and meet the towel again. Rub a soap, and then soak the client's leg. Soak, squeeze, and meet the towel again. And rinse the client's legs. And then pat dry the legs. Wash the feet by soaking them into the basin of water. Sir, lagay ko lang po. Wash po natin yung... Pay particular attention to the spaces between the toes. And then, using a soap, sir, taas lang po natin. Wash the client's feet. Pay particular attention to the spaces between the toes. And then rinse it. Set aside the basin and dry the client's feet. Empty and refill the water again. And for the perineal care, raise the client gown but keep the lower part of her body covered with the top sheet. Ayusin ko lang po. Ask the client to raise her hips, then place the bedpan under the buttocks. Lagay ko lang po ito. And then, wear a clean gloves. And then, wash the perineal area using the stroke of 7 or the 7 strokes. Using a cotton balls with betadine solution, wash the perineal area using the 7 stroke from mons pubis to inguinal area, then on the other side. from mons pubis to labia majora. Then on the other side. From mons pubis to labia minora. Then on the other side. And from the clitoris down to the anus. And then, assist the client to a comfortable position. Baba ko lang po yung paa niyo para maging komportable po kayo. 1, 2, 3. And then, put on the clean gown. Ma'am, lagay ko lang po to. Assist the client with the grooming aids. Deodorant. So, ilagay po natin. Lotion. So, ilagay po natin. And powder. Arrange the bed and make the client comfortable and safe. Ayusin ko lang po itong bed nyo. Okay na po kayo. After care, all the materials used and wash your hands.